Thanksgiving week is starting with a surge of coronavirus cases around the country, including right here in Oregon. For the sixth day in a row, the Oregon Health Authority reported more than 1,000 cases of COVID-19. So that now takes us to more than 66,000 cases, 100 cases in the state. And as demand for testing spikes ahead of the holidays, that negative test result could have you walking away with a false sense of security. Fox 12's BRIDGET CHAVEZ is live in Northwest Portland now with advice from one doctor on the best reasons to get tested.
Yeah, Dr. Vanderlip says that you should get tested for COVID-19 if you've been directly exposed or you're experiencing any of the symptoms. He also says that using a negative test as a ticket into Thanksgiving or a license to travel is not advised. He says you could get a false negative and still potentially spread the virus to loved ones. Thousands are trying to get tested for the coronavirus before Thanksgiving, but Chief Medical Officer at Zoom Care, Dr. Eric Vanderlip, says a negative test could be giving people a false sense of security.
Testing is only as good as the ability of the swab to detect viruses in your nose at the time that you stick the swab up your nose.
Vanderlip says the best time to get tested is when you're experiencing symptoms.
People have the most number of viruses in their nose when they're actively symptomatic, meaning it's been 3 or 4 days on average, 5 days after exposure, and they're having symptoms suggestive of coronavirus is the best time to get tested, where you have the most accuracy in the tests that we use.
He warns against using a negative test result to travel or gather with others for Thanksgiving.
The single one-off spot test for asymptomatic carriers can offer a little reassurance if there's no virus detectable at that time in your nose, but it doesn't mean that you couldn't go on to have virus and then transmit it to others later on.
If you are going to get tested, Vanderlip says rapid tests are not as accurate as the polymerase chain reaction tests.
PCR, polymerase chain reaction tests that actually measure and replicate the viral DNA or RNA actually and convert it into things and then replicate that. Those are the most sensitive and accurate tests on the market.
Vanderlip says the demand for testing is high.
We're doing more testing than we even projected, and we had kind of built out some capacity to handle some additional testing, but it's coming close to overwhelming some of our systems at Zoom.
And he doesn't expect things to let up anytime soon.
We're making a lot of preparations to get ready for a lot of coronavirus infections throughout this winter, and I don't think things will be slowing down this week.
Dr. Vanderlip says if you have any concerns, to make sure to reach out to your primary care doctor to determine whether or not you need to get tested. Live in Northwest Portland, BRIDGET CHAVEZ, Fox 12 Oregon.